we're the nursing staff, we're in full PPE for 12 to 13 hours a day, which is sometimes our respirators, goggles, gowns, gloves. And some of these patients, they're so sick, and honestly, they're on death's door that sometimes you don't even take a break because sometimes you're just even afraid to leave them. So the workload is huge for COVID patients in the ICU, especially the ones that are on life support. It takes 6 to 8 of us, specially trained nurses and respiratory therapists, just to turn these patients onto their stomachs, because it's best to nurse them in the prone position on their bellies. So you can imagine trying to turn these patients with the breathing tubes and the feeding tubes and all of the lines. And it takes 6 to 8 of us to do that. And I think, people look at COVID numbers in the community and they see, oh, there's only 8 people in ICU. It's not that bad. But when you look at the workload that's associated with that, and then also with the 10 to 15 other non-COVID critically ill patients that we're also caring for, the workload is quite high for sure. But, despite all that, we're stressed and the workload is high, but we work with an amazing team of men and women who thrive in these situations, honestly. We're tired and we're stressed, but we've been well trained. The entire Quinte Healthcare senior leadership team and infection control team and our managers and everybody has made sure that we have the supplies we need to feel safe and the training that we need to provide amazing care for these COVID patients. And we're experts at our job, and we're managing and we're coping and we're ready for what else comes. And I really think that some of the unsung heroes in this are, like our portering staff and our HSRs. The amount of cleaning that those people have to do, it's gone through the roof. And I think one of the big groups that gets kind of forgotten about is our respiratory therapists. They are directly in the face of COVID. COVID is a respiratory disease, and they're right up in faces and intubating and doing procedures, and they're crucial in the care and management of these people, and we'd be completely lost without them.
Do you have any reflections or observations or stories that you can share about people that you've cared for from other areas?
Most of them are scared, they're alone, they have COVID, which is scary just in general. They're in an unfamiliar city with unfamiliar people, and there is honestly some language barriers at times as well, and English sometimes isn't their first language. And all we've tried to do is just make it as easy as possible for them, provide them great care. The staff have been great about trying to set up the Zoom meetings for them so they can still see and talk to their family members if possible. We've even been using Google Translate at times as well to try to communicate with them as well. And it's heart-wrenching for them sometimes. They're so scared. And I cared for a lovely young man who was not from our area, and English was not his primary language. And the only thing he could say to me in broken English was, "Please don't let me die." And he was crying and he was scared, and all you can do in that moment is just hold their hand and try to comfort them and hope that you can prevent that from happening. And I think the one thing that we need to remember is that, these patients that are coming to us from the GTA or from Scarborough or from wherever they're coming from, they're not GTA patients. They're not Scarborough patients. They're human beings. They are parents and they are grandparents and their sons and daughters, and they're human beings, and they're Canadians and they're Ontarians, and we have the ability to help. So how could we not?
Can you share with me, Emma, why did you become a nurse? What drew you to this profession?
It's funny, my parents gave me when I was 5 years old for Christmas, they gave me a doctor's kit for Christmas with a stethoscope and a little thermometer and asked me if I wanted to be a doctor. And I said, no, I'm going to be a nurse. And it's all I've ever wanted to do. And I really can't pinpoint why. There's that cliche, oh, you want to help people. And sure, like that's a huge part of it. It's a tough career. It's 12-hour days and nights. It's holidays, it's weekends, it's overtime. But, I think of that little man that I looked after, and when you have a patient who's begging you, crying, saying, please don't let me die, and you get to watch him walk out of the ICU and go back home to his family, how could you not want to do this job?